They are caught up in a war with invisible enemies. You don't hear the guns, you don't hear the bombs, but you don't see the soldiers. It's just killing them, and therefore they ought to be honored.
Serving the Guyanese community here in New York for many years is Honorable Consul General Mrs. Barbara Atherly. A humanitarian at heart with vast experience in disaster and emergency preparedness, she has been in direct contact with many families affected by COVID-19 all across the United States and gets a real sense of how families are impacted by this pandemic.
On March, I think it was the 17th or thereabout, I got one call that one of the famous Guyanese drummers, his mother died, COVID. Another very popular musician from Guyana, his sister died, so they called me, I know the sister. Then another popular Guyanese, Billy Braffett, who was a very, very close, hard-working member of the Guyanese community. He died, and I was like, what's going on? So the numbers kept coming in and the calls are coming in.
A few days ago, the United States recorded a staggering 100,000 deaths from COVID-19. New York State accounted for 29,484 deaths as of May 29th, according to the Johns Hopkins Coronavirus Resource Center. Majority of those deaths are in Queens and Brooklyn, many of whom were Guyanese.
This is a woman who got sick, went to the hospital, tested positive. Unfortunately, she died. Now, this is someone who has children in Guyana, right? And I think one or two others here. So the daughter who lives in another state comes to make arrangement, comes to New York to make the arrangements for her, and made arrangements with one of the funeral homes to retrieve the body from the hospital. And when the funeral home turned up at the hospital, they couldn't find the body. It's not just that her mother died, but she just couldn't find her mother. Later on, we, after a number of search and tracing, it was caught up in that, there was a fiasco in Brooklyn with a funeral home.
Yes.
The body was actually there.
Dozens of bodies were discovered at this location, according to the New York Times. She has set up a Facebook page to honor those Guyanese who would have died from the disease.
We don't have the true numbers from our page that we set up. We have 86 so far, but the numbers are more. We had Maryland, Minnesota, we had Texas, we had Orlando, lots in Queens, lots in Brooklyn, New Jersey, Connecticut, the Bronx, but they're all over.
Atherly, an international public servant who served the United Nations Children's Fund, UNICEF, for over 20 years and served on emergency missions to India, Pakistan, Bangladesh, and also worked in active war zones such as Syria, said she gleaned on her experience to manage emergency situations such as this one for many stranded Guyanese.
There is a Guyanese woman right now. She is hospitalized, but she came up for medical treatment. The medical treatment was done, and she doesn't have anywhere to stay, so she's still at the hospital. So, but they wouldn't really, they keeping her doing therapy, so they don't want to release her from hospital unless she's going back again. We are not her next of kin, so we couldn't speak directly to the facilities. We managed through an NGO to make contact with the hospital because her family in Guyana, they were concerned and they reached out to us. So we had an NGO to work on our behalf, and then they linked us up. So I spoke with the doctor, and the doctor gave me her information and contact numbers so that the family can have direct contact with her.
This scene of stepping in to help families played out in many other instances, and more so for families who would have lost a loved one from the disease. Atherly said she was stepping in, calling on other Guyanese who are frontline workers, many nurses and paramedics, to assist other families. She indicated the Facebook page was established in efforts to honor a life and a person of value.
Let persons know that this was a human being. This was somebody who contributed to society. This was someone who's loved. It was a mother, a father, a brother, a sister. They all belong. And I just thought that we shouldn't just leave them there as a statistic, but to bring the human touch to a valued life that was lost through to no fault of theirs.
In New York, it's not just Guyanese, but other Caribbean countries are recording numbers equally as high as Guyana. As a member of the CARICOM Consul Corps, which comprised the CARICOM Consulate Generals with representation here in New York, Atherly is involved in weekly meetings with member states, sharing best practices and making decisions as a unified body. One such pertinent recent decision proposed by member states to the current chair, which is Barbados, is a letter to the mayor of New York, Bill de Blasio, asking for an idea of the number of nationals from the CARICOM countries who would have died from COVID-19.
Some of them have like know about 2 or 3, but others like Barbados and Trinidad and Tobago, Jamaica, the numbers are very high, like Guyana.
With this report from New York, I'm Jennifer Jabbar.